of Wisconsin-Madison. Thank you for joining us for today's webinar, Helping Consumers Maximize Their Healthcare Benefits and Spend Their Money Wisely. This webinar is being conducted today with a CFS partner organization called Covering Wisconsin, formerly known as Covering Kids and Families. Covering Wisconsin's current initiative, or one of their many initiatives, I should say, is seeking to empower consumers with information on accessing and using health care. This is of extreme importance to the financial well-being of individuals and families, which is why we are very excited to have Stephanie Sievers, who is a health insurance literacy specialist with Covering Wisconsin, here to present today. Just a reminder before we get started with the presentation, to submit questions to be answered in the Q&A portion that will take place in about the last 15 to 10 minutes of the webinar. Please submit your questions in the Q&A box located on the left side of your screen. And with that, I will turn it over to Stephanie.
Thank you. Thank you, everyone, for joining me this afternoon. I wanted to add that Covering Wisconsin, we broadly provide education and outreach around health insurance that is publicly available, and we have several grants that allow us to do that. For example, we have a grant from the Centers for Medicare and Medicaid Services to be a federally licensed health insurance marketplace navigator entity. And really focusing on this current project I'm going to talk about today, we started that in 2014, and that is our Health Insurance Literacy Initiative to assist consumers in how to understand and access health care. And I am the lead on the two health insurance literacy projects. My agenda for today, I'm going to talk a little bit about the background on the project and some of the strategies we employed, and then I want to take an in-depth look at 7 handouts that can be used for consumers. And I just want to give a brief mention of our funders for my project are the Baldwin, Wisconsin Idea Endowment, Wisconsin Department of Health Services, and Wisconsin Health Information Organization. Our goals with this project are to empower consumers to make sound financial choices about their health care, and to encourage consumer engagement in the healthcare system to get the best quality care. As more and more consumers are becoming insured, it's important to address the intersection of healthcare choices and needs with sound financial choices. And we want to encourage consumers to find the most appropriate health plan to fit their financial needs and their health needs, and for consumers to understand their role in getting the right health care at the right time. Our audience is principally consumers who are new to health insurance. We design the materials thinking of consumers who may not have much experience with health insurance, or maybe they have never encountered it, but they don't have a lot of reference in order to help them understand what their options, choices, and roles might be. So we started with the basic premise that health insurance is complex, as I'm sure most people would agree. Language and plan descriptions are too difficult for most people to understand, which the consequence may be that people don't choose the best plan for their needs or their budget. And many consumers don't fully understand how to use their plans once they have purchased them. Therefore, they may not take advantage of preventive care options, and they may make choices that cost them more money than necessary. So something that we think is really relevant to the project is that a lot of families who have medical insurance are still accruing medical debt. So therefore, they're going to need some well-informed choices about health insurance. This is essentially something we all need to think about moving forward. A lot of the plans that are available to the public on the marketplace tend to have a growing, increasing amount of high deductible. So this is really something that's people are going to need to be aware of moving forward, is how they can purchase a plan but still accrue a lot of medical debt. So there are actions and choices that consumers can make that can help them spend their money wisely and get the most value from their health care benefits. So for example, they could better understand which plans can meet their health needs, go to the right medical provider at the right time, understand which providers, hospitals, laboratories, and clinics are in their network, monitor and maintain their health with preventive care, know when and who to ask if additional care or services are covered in their plan, and get the most from doctor visits by asking questions, understanding all their options, and following the doctor's recommended care. So all of these ideas for action or choices, we have integrated them into the material itself. So all of the materials, they've been designed using action steps as often as possible, plain language, relevant images. As you can see on the screen, I have an image of a 24-hour call nurse, as much white space as we can maintain, only pertinent information, large fonts, and every single sheet has been consumer tested. I want to add that for the action steps, a lot of consumers feel comforted when they can get a handout or a sheet that tells them what to do, because they may not have much experience in the healthcare system, and so it's really difficult for a consumer to make a choice without relevant experience to base the choice on. So we have used best practices for quality healthcare when we've considered what action steps to provide. So the topics of the materials that I'm going to look at with you today, they break down into two different sections. We have plan selection and then using your healthcare effectively. Within plan selection, I have 3 different sheets. The first one is getting started, and this really covers a lot of your basic insurance terms that seem to be a real sticking point for a lot of consumers. The second one is how to pick a plan for your budget, and that's just getting consumers to think about what they need to consider. And then understanding how premium tax credits work. If you're not familiar with those, I'll give a little more background information in a few minutes. The second section, using your healthcare effectively, that's going to look at quality medical appointments, where to go for care when I'm sick and I don't need the ER, understanding a network, primary care provider, and the specialist, and then lastly, what's free? So what's included in my policy? We're also currently working on a couple more sheets that are going to be ready within the next few months, and that's how to pay medical bills you can't afford and understanding your explanation of benefits. So first of all, I'm not sure how many of you have a background on the health insurance marketplace, so I wanted to give a bit of background information. This is the federally funded healthcare, it's like healthcare.gov website where consumers can shop for health insurance in states that do not have their own marketplace. As consumers shop for plans, they will need to make financial decisions about which plan would best fit their needs. So consumers who don't have a solid understanding of how copays, coinsurance, deductibles, and out-of-pocket costs work, they're going to struggle to make sound financial choices. So once consumers are within the website, they have different plans that are available to them. But the cost, first I'll talk about the cost, but the cost is influenced by if they smoke, where they live, and their age. The second part of cost is based on the type of plan they might choose. So if they choose a bronze plan, for example, that bronze plan would pay for 60% of the covered benefits, and then they would be responsible for the additional 40% left over. And so you can see there are 4 different levels: bronze, silver, gold, and platinum. So the marketplace calls these metal levels, and consumers don't necessarily get a lot of background information about what the levels are before they're kind of having to make a choice about what kind of level they might want. And the bronze plans have the cheapest premiums. Many consumers can get help to pay for costs, and that does depend on their income. So I just wanted to briefly cover a couple of types of financial assistance. First, we have the premium tax credits, and that is available for individuals who are between the 100% to 400% federal poverty level. So, for example, for one person, an individual, that would be between the ranges of $11,670, that's a yearly income, to $46,680. And then you can see that that bumps up depending on your household size. So, and the marketplace takes all of those numbers into consideration. There is also some cost-sharing assistance, and this is sort of tied into a silver level plan, and what it is consumers who qualify because they're between 100 and 250% of the federal poverty level, they can get the price of what they would pay for a silver plan, which is a little bit more affordable in general for the premiums, but then they get the benefits of a platinum plan, which has lower out-of-pocket costs as they use it. And I'll talk a little bit more about that in a few minutes. So now I'm going to go into the materials themselves. So I'll spend more time on some sections and less on others, depending on what I have found to be the most important for consumers. So this is the first sheet, the Getting Started, and we've included all of the really sticking points of those insurance terms that people really struggle with. And as we've defined each term in plain language, we've also tried to include a visual that helps define what the term means. So as we design these, because we are a navigator entity, we have a lot of people in our organization who help consumers enroll in a marketplace plan. And they're working one-on-one with consumers, and they have found this to be exceedingly helpful, that as they're needing to explain what a deductible is, what a copay is, that they have a visual that they can use to help them really explain that concept. On the back side of this, we have a visual definition of the coverage levels. So as you can see, the premium column for each of the levels, the bronze, silver, gold, and platinum, we can see that you pay a lot more as you select a plan higher up on the coverage. But then consumers can get a better idea with this visual that, okay, so yeah, the premium of a bronze plan might be quite affordable, but if I have to use that health care, I might be paying a lot of money out of my pocket. So we found this to be really helpful to help consumers sort of understand how that all works together, how their choice of a plan is going to affect what they might pay when they access that health care. And then lastly on this is a chart that we developed for anyone who's working one-on-one with a consumer, but especially a navigator. As you work at the marketplace website, they will show you some plans that you qualify for. And we have found that consumers better understand all that information if they're given a visual of how it all works together, especially when they're looking at not just the definition of a word, but how that would relate to them and their pocketbook. So we found this to be exceedingly helpful to help consumers understand the terminology and how it works in concert. The second sheet I have here is a plan for your budget. And this sheet was developed thinking about an enrollment assister or a navigator working one-on-one with someone to get them to think about what they need in a health insurance plan and what kind of financial costs they need to think about. So the first thing is, what are your health needs? And we have some leading questions here for people to think about. If they take prescription medicine, do they typically see the doctor several times a year? Do they have some type of disease or illness that requires a specialist or regular management or surgery? How often do they go to the emergency room? And then also you can see in the picture, thinking about if you have children, maybe there's a pregnancy that might be coming up that you're planning to happen. So things for people to really think about. Second is, what is their income level according to their household size and whether or not they're going to qualify for the cost-sharing reduction. And that is the plan that is the premiums are the cost of a silver plan, but the out-of-pocket costs are more like a platinum or gold plan, which we have also given a diagram there, a visual that helps people understand how that might work. On the back side, we have getting people to think about, well, what is the network? What kind of clinics or hospital are going to be located in my area? Or do I have a doctor that I want to stay with? And which insurance company companies do they work with? Thinking about if I have regular prescriptions, especially if they're brand names and they're not generic, some insurance companies have really high prices on those brand names, and others will have more affordable prices. And it's not standardized, and it really is in the consumer's interest to call around. Some of this information is available on websites, but it's rather difficult to access if you're not accustomed to using them. So we really encourage consumers to call. And then the last thing is how much of a monthly premium you can afford. And we put this last because it tends to be the first thing that consumers think about is how much they want to pay a month, and potentially neglecting to think about what their health needs are and how much that might cost them if they're choosing a plan that has a lower premium, but then they're going to the doctor regularly and having to pay a lot of money out of pocket to access those services. Okay, so my next sheet here is the premium tax credits, and this is a rather complicated topic for most consumers to understand. And this is essentially what is helping them if they fall into the income bracket of 100 to 400% of the federal poverty level. It's what's going to help them pay some of those premiums. So to qualify for premium tax credits, you have to meet 5 criteria. You have to purchase your plan from the marketplace. You cannot have an affordable health insurance offer from your work or your spouse's work. And this one can be really complicated for consumers to understand. The way the law is written is that the affordable plan has to be affordable just for the employee, the person who works at that organization. So whereas when you add the family on, it might be more expensive than would be considered affordable. The law only considers if it's affordable for the employee. So this is a case where the family would not be able to get tax credits through the marketplace. Whether or not and we're in Wisconsin, so our Medicaid program is called Badger Care Plus, but whether or not you qualify for a Medicaid program you have to be, you cannot, okay, so you cannot be claimed as a dependent by another person. So everyone who is getting the tax credit has to be on the one tax return. And then lastly is you fit the income guidelines, which is the 100 to 400% of the federal poverty level. And we have found a lot of enrollment assisters find that working through the checklist is a nice place to start with consumers so that you can find out right away whether or not they qualify for the premium tax credit through the marketplace, or maybe they might even qualify for a Medicaid program. So let me go back to that. So I also included on this in the front, in the example, we have a short example that kind of gives consumers an idea of how these tax credits work. And these numbers were actual real numbers found on the Marketplace website. And these are for Milwaukee, Wisconsin. And this was a married couple, and their income was $43,000 a year. So their premium without the tax credits would have been $650. But with the tax credit, it would be $475, leaving them a monthly cost of $175. So really just the simple sort of number explanation seems to be what people understand the easiest of how tax credits work. However, I have to say there's an additional difficulty that a lot of people don't understand, that these are tied to their income tax returns, and those who don't legally have to claim taxes may fall into a little bit of confusion, not understanding that they have to file a tax return if they do get premium tax credits from the marketplace, which might mean that they get a letter saying they have to pay back the tax credits, or they won't be offered any tax credits for the following year. So this is something that has been of confusion for a lot of consumers. So when consumers are on the healthcare.gov website and they're told they qualify for tax credits, they're given a screen and they have to make a quick decision before they can move on. They have to decide how they're going to use their tax credits. And unfortunately, once that screen is gone, it's really hard for consumers to kind of understand what decision they just made. And so we thought that this sheet would be helpful for those who wanted to better understand the choice they made and how it will affect them. So they have some type of documentation that explains how it all works. So the choice they have is to use all, use some, or use none. Most consumers use all because paying the out-of-pocket premium, or paying for premiums out of their monthly pocket is rather difficult for many consumers who are in that 100 to 400% of the federal poverty line level. So most consumers are choosing to use all to help them make that payment. However, for consumers who might have a fluctuating income or some change during the year, if they don't report that change, they could owe some tax credits back at the end of the year. So this is where a lot of confusion has been. If they use some, now this is a great option for those who have fluctuating income levels, but I think a lot of consumers just really struggle to understand how that all works at the end of the year, and most just really need the additional help to make the premium payments. And lastly, the use none, which would mean that consumers, all of the amount that they qualified for, they could potentially get as a refund at the end of the year. So I have to say we struggled with putting this sheet together because we always like to minimize the amount of words on a page. But in an example such as this, you're really telling a story, and telling a story often requires more words than you might want to use. So we have found that the actual numbers of the story seem to help people kind of understand the idea. Okay, so that was the last sheet I'm going to present that has to deal with plan selection. So the second part of this is, well, okay, I have health insurance. How do I use it? And I'm going to start with quality medical appointments. The idea here is that consumers really want to get the most value for their money, and so they have a role to play when they go to those appointments to really communicate with the doctor and make sure that they understand what's being communicated to them. So with this in mind, we really want to encourage people to make those appointments. Once they call and make an appointment, they really need to show up, and they need to show up on time, and they need to show up prepared. Having a list of maybe supplements, medicines, and questions can go a long way to making sure that you get all of your needs met while you're at that appointment. It's very easy to forget what you want to discuss with the doctor when you're sitting in the office. We've also got on the right-hand panel, we like to define a lot of the terms that we are using within. So as you can see in number 1A, call your primary care provider. Since provider isn't a word that really resonates with consumers, we've defined that word on the right-hand side. And you might find in other places on these sheets, if I didn't have a space or it wasn't appropriate to define provider at that time, I typically use doctor. I want to err on the side of consumers understanding what I'm trying to communicate to them, although I would like them to really learn to use the word provider. So we do use it and define it. Oh, and then the bottom, bring someone. This is also something that really helps consumers who might struggle to understand doctor's instructions. If you have someone with you, they can really help you remember what was said. So with that in mind, in section 3, we have step-by-step, what are you going to do at your appointment? And maybe they won't do all of these things, but this really kind of gets them understanding what might be expected of them at that appointment. And what I really want to point out in here is that in section D, a lot of doctors are getting training on using a teach-back method, which is asking consumers to repeat back their instructions in their own words. However, as doctors are rather rushed and see more and more clients on a daily basis than they maybe did in the past, they sometimes might forget that step, or maybe they don't have time. So we're really encouraging people to repeat back what they understood. Another thing that's really important, a lot of consumers who don't have a lot of experience with the healthcare system, they may not know that it's really important that they communicate if they can't afford or don't want a treatment that a doctor might be recommending, because this can really affect their health results. And if they can at least engage in that dialogue and communicate that to the doctor, then the doctor can potentially provide some other options. We've included a list of questions that might help consumers think of things they might want to ask their doctor. And then in 4, just really reminding people to follow the instructions, to pick up their medicine, and to take it on time. Okay, so this next sheet is I'm sick, where do I go for care? This is really to help new consumers understand that if they're feeling poorly but it's not an emergency, that there are several places that they can go for care that may not be the emergency room. This is really important for consumers who may have only had experience using the emergency room in the past. When we consumer tested this sheet, it was very interesting. Most new consumers did not understand what a 24-hour nurse hotline was or how to use it. They didn't see how it could possibly be relevant for them. And many did not know that they could call their doctor's office after hours. And these are two of the options that are very good options for consumers. So that was why we put them on top, sort of a thinking about who I might call first. Some consumers knew about an urgent care clinic, but they may not have understood clearly when to go to urgent care versus the emergency department. And so we listed, this is based on the NIH website's list of symptoms of when to use urgent care. So we listed what are the frequent commonalities that are easily treated at urgent care. And the back is pretty much just asking consumers, okay, so we're talking about this before you're sick. Maybe it's time to do some research, find out who do I call for certain things, what is the hospital that I'm most likely to go to that is covered in my plan, what is my doctor's phone number. And the most interesting thing about this in consumer tests, consumers loved this. I was really surprised because we don't get as many of these important contact sheets as were common about 20 years ago. But they love the idea of programming the numbers into their cell phone. And some of our consumer handouts we did test at, for example, a men's shelter, and one of the comments they made was, well, everybody has a cell phone. So I thought that was really relevant. So some of the enrollment assisters and organizations that we've been working on with piloting our materials, we're asking them to start filling out, if they can, at least a few of the sections with consumers to get them sort of motivated and thinking about, well, where can I go? Because frankly, being prepared and knowing where you're going to go when you're sick or who to call is going to save consumers a lot of money. This third sheet is understanding networks, primary care, and specialists. We tried to define a network and kind of how primary care is your centralized, your primary care provider is the person who's sort of overseeing all of your healthcare needs in the image that we have on this page. We're considering adding some additional images to sort of help explain in and out of network, but we're still pilot testing to see if this is going to be effective. On the back side of this one is how to find a specialist who's covered in your network. I got some really interesting feedback from some health plans, and that led to a few changes that I think have really made this much better. First of all, some people were surprised that we were encouraging people to think about needing a specialist before seeing their doctor. And that's not really the idea. The idea is that if you think you need a specialist, instead of just going out and making an appointment with a specialist, there's a step of procedures that you should go through before you do that. And the first of all is you might need a referral, and if you call your primary care provider talking about a specialist, your primary care provider might be able to just take care of that for you, and that might prevent the need of a specialist. But then there's an additional step that a lot of people are not aware of, and that is that they may need approval from their insurance company to see the specialist. So it's not just that they get a referral from the doctor, but they might need to additionally call the insurance company and ask for approval. So that was a really good addition that we think is going to really help consumers to better navigate the system. And then lastly is asking that insurance company which specialists are in the network, because this has been something that has been really confusing for a lot of consumers, is understanding that they have to find a specialist who is in their network. And that can get complicated by not all networks may have all kinds of specialists available. So again, step 5 is really important, calling that insurance company and getting the information you need. Okay, so the last sheet is what's free. You have health insurance. And this is really about preventive care. I had a couple people say to me, well, but it's not free, it's included in your plan, but it's just not as exciting or catchy, and it doesn't speak as loudly to a consumer if I say, well, included in your plan are the following things. When we consumer tested this, we just found that consumers really, really responded to that question of what's free. So preventive care is covered. Many aspects of preventive care are covered in most health plans, but there are some really tricky things about it that consumers need to be prepared for. One, if you look at the what is not free box, many prescriptions are not free. Some tests are not free. If you go to a preventive care visit, which is included in your health plan, and you get diagnosed with something, then you will be charged, more than likely you'll be charged for that visit. Or if you need any additional care during your yearly checkup. So as you can see here, the first step is call your insurance company and ask what tests might be free. Ask where you might go that's in network. And second is schedule your checkup. But if you look at the steps within that, I've tried to, I think I have 2 or 3 times in there, ask if it's free, because this is something that really, really trips consumers up time and time again. If you'll notice on the right-hand side, next in the third box down, the third purple box down, women may also get an additional well woman checkup for free. During consumer testing, I had several women who were unaware that they could actually get both a yearly exam with their primary care provider and a well woman checkup. However, that's not the case if your primary care provider is an OBGYN. But on the back side, we have a list of some preventive services. Now, this is not a list of all preventive services, but things that would be most important maybe for the consumer to know, to bring up in a visit. For example, maybe a woman is thinking about trying to get pregnant in the next year or two, and so she may need to know that folic acid vitamins are available and are a free service in her health plan. It's important that people understand that there are a lot of yearly or frequent types of tests for children and teens that are available that have to do with development and behavior. And let's see. I know that personally, when I had a baby, within the first couple of years, there were some strange symptoms that I thought might be signs of autism, And I think it would have been really, really helpful to know that autism testing was included in my health plan, because I didn't think it was. So that's my own personal one that I think is really helpful. On the bottom part of that is an example, why was Jane charged? And we think that this is by far the most helpful thing for consumers to understand. So this is a story of Jane. She goes to her yearly checkup, and she's confused because she got a bill, and she doesn't understand why, because she thought it was part of a preventive free visit. And it's because during that visit, she asked the doctor about a rash, and it turns out she had athlete's foot. So the doctor coded it as a diagnosis, and then she got a bill later on. So when and where to find the materials? We're going to start making a lot of these materials available in November. Some will be released in early November and others in late November. It just depends where we're at within the pilot we're currently conducting. We're conducting a pilot study in 3 intervention regions, and based on feedback and completion of the pilot, we're going to be making some hopefully small changes to what we have. Most of these will be available at our website, coveringwi.org, and I just have to say that it happens to be down today, so if you would like to go there, I called tech support this morning and they said it should be back up by tomorrow morning. And I've put samples of the 7 sheets that I covered today. Now they do have the word sample across them because we're not quite ready to have them released as we're concluding our pilot study. And lastly, these can be printed in both color or black and white. We've tried to really be cognizant of the color selection and the tone so that it prints quite nicely in black and white. So that concludes the main part of my presentation, and I believe there are some questions.
Yeah, thanks, Stephanie. That was great information, and those handouts are excellent. I'm going to go ahead and dive into some questions that we've received. For instance, regarding the handouts and the information sheets, how often do you plan on updating the information?
Oh, so within the first few months, they're likely going to be updated quite frequently or as needed, because we're really trying to get the best thing out there for consumers. And then as needed as we move into the future. And, you know, part of what we do, we do have navigators, so we are very careful that before every enrollment period, we always check our materials and update them as needed.
There's a question regarding, actually a lot of people have kind of asked this, because the actual name of your organization is specific to Wisconsin. There's a lot of questions about whether these handouts or these information sheets are specific to Wisconsin, or if they're nationally relevant, or if there even is maybe there are just a few, especially looking at the tax credits and in particular, if those are Wisconsin-specific tax credits or if that's federal?
No, everything I've presented today is nationally relevant. The tax credits are federal. Now, the only thing that, and I can't answer completely, but I do know that many states have their own marketplace. So for some of these topics, it may not be as relevant, some of the topics, but again, that might just be the federal tax credits, because most of the other stuff is really just about health insurance in general. And making those good choices that are, you know, so you can really maximize your benefits, you can use your health plan appropriately so you're not spending extra money. And, oh, I did want to add, we do have, for Wisconsin, we do have additional sheets that are for Badger Care Plus, which is our the name of our Medicaid program. And I do have a whole line of sheets for that coming as well that are in pilot right now.
Great. Question about who this was, or what population these sheets were tested on. Can you give a little bit of background on who Covering Wisconsin actually kind of, you kept referring to in your testing? What populations did you meet with to see how these would respond?
So with the consumer testing, we did some testing with literacy organizations. We did testing with men's shelters and community health organizations. So those were our primary focus group, one on, a small group in-person testing. We looked at images, we looked at all the words, we talked about what the sheets were for, and that was exceedingly helpful to know where consumers are at in this process. And in order to participate in that, they had to be new to health insurance, at least within the last 2 years, and be between the ages of 26 to 64.
Okay, great. Let's see.
Oh, and I did want to add, we're also doing, as I made reference to our pilot testing right now. So that's in 3 different regions in Wisconsin, and within each region, we're working with 7 to 9 different organizations who work with consumers, and it ranges from counties to health plans to community health centers, enrollment assisters, so people who sign people up for health insurance, and navigators. So it's kind of a wide mix in the group, and we're waiting to hear feedback about how's it going, what's helpful, what might need to be improved. So this has really been, this project has a really long-term sort of look at how can we take the time to not just develop something, but how can we make it really serve the needs of the consumers who are going to be using our health insurance.
So in that same vein, there was a question about, the fact that you've piloted that, the response to the materials. So are you guys going to be doing any sort of evaluation to see how this program has actually improved accessibility or consumers accessing health care?
Yeah, so we do have a consumer evaluation as part of the pilot, and it really is trying to, it's a questionnaire for those before they've used materials and then after, to try to get at, well, did their understanding improve? Do they think that they would make maybe some different choices? And we don't ask it specifically in that way, but that's what we're trying to get at. Will they make different choices now that they have some different information, so that we can really see, is this going to affect consumer understanding and their attitudes and how they access care?
Great. So you had mentioned, Stephanie, that there were going to be some more handouts possibly, or you have like some evolving kind of more information sheets specific to Wisconsin, I think you said. But what a few people are wondering about is if you're going to come up with any more regarding other topics that consumers might find difficult. For instance, someone asked about including an information sheet on how to contest charges with your insurance provider. Is that something that you're planning to do in the future, or are you planning to expand the topic areas?
Definitely. Yes, moving forward, we are, actually that is one of my topics on my list. We realized that we wanted to start with first, how do I choose the right plan? And then how do I use the plan? And next is, well, now that I've got this plan, maybe something went wrong, and what can I do? So for example, I had mentioned I'm going to create a sheet for consumers. Maybe they can't pay a medical bill, and they need to know what kind of steps they can take or what they can do to resolve a large medical debt in their life. So yeah, we're gonna address those issues moving forward.
Let's see. Another question that we had was regarding when a practitioner or a service provider actually is using these sheets one-on-one with a client. What would you say, in your experience, is the average amount of time that's needed for an explanation of an info sheet? As we were watching in this presentation, I think you went through them, pretty quickly just for the purposes of this webinar. But what would you say would be the typical amount of time that a counselor or social worker, say, would need for explaining a sheet like this?
Well, everything depends on where the consumer is at. As we work with consumers, we have to think about meeting them where they're at. So a consumer that has absolutely no experience with the healthcare system or with health insurance might need a lot more explanation of what a deductible, copay, coinsurance is. I didn't present it today. It's not quite ready. I do have an example sheet that kind of tells a story of a consumer and how those costs all work together, and that will be coming out soon as well. But really, some of these topics tend to be really tough for some consumers, but those who maybe have been kind of getting by and learning by sometimes even making mistakes, but learning by using their plan, they might have some understanding. And in some of my pre-test results, I've noticed that more people tend to know what a copay is, for example, than a deductible. So this has become a word that's becoming more frequent, and people tend to pick up that idea a lot more quickly. So it just really depends where they're at in their process. So someone who has more experience, maybe you only need 10 or 15 minutes to explain an idea. And for someone who has less experience, you might need, 30 minutes or so to really explain an idea. So I really designed these with the idea that they would be a tool to use to explain a concept, and you can really use those images as part of the explanation. But then if the consumer needs, they have the words that they can it's like a takeaway, and they have the words that would go with the image so they could refer to that later, sort of increase and reinforce what they had been told. Another thing I did in the organization is that each sheet is a different topic. Not all consumers are ready to get all of the topics at once. It can be quite overwhelming. So sometimes it's really important to realize where that consumer is at and what information do they need today, and to provide that at that time.
And I have another question about actually the information sheets, of course. And forgive me if this was already answered. I don't think I remember hearing it. But are they available in other languages, or do you have plans to make them available in other languages, or are organizations free to have them translated themselves?
We will be putting them into Spanish as well. And I can't give you a solid date on when that would be, but we would hope for the end of November, but it may be a little additional time on the Spanish language version.
Okay. Well, you know what? I think that is all the questions that I'm going to go ahead. A lot of the questions that I've received are a little bit specific to kind of, you know, how to actually kind of use insurance, and I think this webinar was really meant to showcase the materials. And so with that, I think we'll go ahead and wrap up.
Okay.
Stephanie, thank you so much for this excellent information and for creating these materials. I know that a lot of time and energy has gone into the creation of this, and I think everybody thanks you for that. And I wanted to remind...
I'm super grateful that I have a great team to work with and a fantastic graphic designer. So.
Yes, you do. I know that. Yeah, you do. And they look really nice, too. So I think everybody's just really excited that these are in existence now. So I also wanted to remind all of our listening audience that we do have a webinar coming up in November. It'll be November 17th. This next webinar will be presenters from the National League of Cities. They're going to discuss findings from a city scan of local financial inclusion efforts that was conducted by NLC. So we'll be sending out that registration coming up in the next week or two. So we hope everybody will join us for that. Again, I really would like to thank Stephanie Sievers for her presentation today and for providing these materials. And please, everyone, stay tuned for November when they will be available. I would like to reiterate that CFS will make this webinar available on our website fairly soon after this live presentation actually concludes. That is cfs.wisc.edu. And I believe that Covering Wisconsin will also be posting this on their website at a later date. Please feel free to contact Stephanie with questions. I'll go back to this page with her information. Or you can contact me, Hallie, and my information was included in this as well. I will be posting the PowerPoint in addition to the recorded webinar as well if you're interested in just flipping through the slides yourself. And with that, I would just like to thank all of our participants who logged in today, and we look forward to our webinar next month and seeing everybody then. Thank you.
Thank you.